Assalamualaikum. My name is Muhammad Ezzad bin Roslan, alongside my partner Muhammad RAZIN bin Muhammad Rashid. We are from AM 228 of Bachelor of Administrative Science and Honours, and our research is the study on the factors of drug abuse among youth. So, from our research background, individuals from varying backgrounds can face issues with their drug use, especially towards age, race, society, or the reason they began utilizing drugs in any case. A few people attempt at a different thing with recreational drugs out of curiosity, because friends are doing it to have a good time or to ease the problem that interferes with their life. Drug abuse, according to World Health Organization 2019, which is on their website, they say that the use of a substance for a purpose not consistent with a legal or medical guidelines, and it also in the non-medical use of prescription medications. According to National Drug Intelligence Center 2006 in America, they've said that the negative consequences of drug abuse affect not only individuals who abuse drugs, but also their families and friends, price business, and government resources. So, to relate our project, we are focusing on the drug abuse among youth, which we all knew that youth is the prospect of the future. If our youth has been tainted by drugs, so therefore we cannot expect that they will give 100% productivity in the near future. Based on the problem statement for our research, based on the 2019 National Anti-Drug Agency, which is AADK statistic, it showed that drug abuse among the younger generation in Malaysia is becoming a cause for concern, with children as young as 7 getting involved in it, quoting Belvin in 2018. Furthermore, according to Certified Fraud Examiners Association Malaysia, which is in Malaysia chapter, President Datuk Seri Akbar Sattar, 2019, a study found that 2,169 abuses cases last year involved students from primary school, secondary school, and university college. So, all of the problem statement have shown that the youth are in fact dwell in drugs. So therefore, we must find the factors which all of these youth are being involved with drugs in the first place. So, we have constructed our research objective and research questions. So for our research objective, the first is to identify whether family history affects drug abuse among youth. As we all know, youth tend to live with their family at the beginning of life. So therefore, family can be a very big impact for them. So therefore, this is the factors that we must learn and to know whether the family are in fact the factors for them to involve in drugs. So the next objective is to identify whether mental health are the factors of drug abuse among youth. As we all know, even though our hair color is the same goes to our blood, but the people itself, the characteristic of the people itself are different from one another. So our suggestion is that mental health is different from one another. Maybe the mental health of the drug abuse, the drug addicts, are different, are weaker compared to other people. So therefore, that is one of the factors that we must take account for. And lastly, to analyze whether traumatic event causes drug abuse among youth. Traumatic event can become a pivotal tragedy in life, because the person can be changed and be shifted towards another section of their life based on the traumatic event which happens. So therefore, we also confirm that traumatic event is also one of the factors of the drug abuse. So our research question is, the first is how family history affects the drug abuse among youth. How does mental health become the factors of drug abuse among youth? And lastly, how does the traumatic event causes drug abuse among youth? So this is the conceptual framework for our research. As you can see on the independent variable, we have family history, mental health, and traumatic event. And so on the right side, as we can see, is the dependent variable, which is what we trying to have a research for, the factors of drug abuse. So for our research design, we're using qualitative method and we're using single case study. So for the unit of analysis, we're focusing on the facilitator in both Rumah Sahabat, Lulangat, and Teruhan Kasih in Bukit Beruntung. Since our research is mainly focused on the two of the facilitator, therefore our sample size is mainly on the two respondent himself. And because of the two respondent, it allowed, according to Professor John Morrison of the Johns Hopkins University. So for our sampling technique, we are using purposive sampling. And lastly, for the data collection, since we go to the Rumah Sahabat Ulangan and the Turun Kasih Selangor, so therefore we're using interview and also analyzing and taking notes from the facilitator himself. The research method continuation. For our measurement, we'll be using interview protocol. In our interview protocol, we divide it into 5 sections. Section A, Section B, Section C, Section D, and Section E. For the Section A, we'll be using respondents' information. Section B is the effects of drug abuse among youth. The Section C is family history of drug abusers. Section D is the mental health of the drug abuse. And the last is Section E, which is the traumatic event for the drug abuse. And lastly, for our data analysis, we'll be using narrative analysis and content analysis. This is because in narrative analysis, we can use on the factors to identify whether family history affects the drug abuse among youth, because it's based on stories, based on what happens. In content analysis, to identify whether mental health is the factors of drug abuse, because we are studying on the data, on the statistics being shown by them. And lastly, narrative analysis can be used on a traumatic event. As said again, it is a story, it is a life tragic event which can be used and learned. So that's it.
The finding in drug abuse among youth, we use a qualitative method to get the data and information. We have interviewed two professionals in handling drug abuse, which is Rumah Sahabat and also Teruhan Kasih in Selangor. For the first finding, which are to identify whether family history affects the drug abuse among youth, we can see that parental substance abuse has harmful effects on children. Since these parents often cycle between relapse and recovery, during times of heavy substance abuse by their parents, the children may be abandoned both physically and emotionally. So the information support the research objective. The research by agree and give more support that children from families with a history of addiction will face high risk to become a drug abuser, and children also will follow their family's footsteps because parents act as a role model for their children. The family history and as a bigger role since there is the nearest with each other. For the second finding is to identify whether mental health are the factors of drug abuse among youth. Dealing with drug addiction, substance abuse is certainly not easy, and it's even further complicated when they are struggling by mental health problems. Informant also stated that they use drug to cope with difficult emotion or temporarily change their mood, and substance abuse may sharply increase symptoms of mental illness. For the third finding, to analyze whether traumatic event causes drug abuse among youth. Exposure towards traumatic life e- experience such as sexual abuse and physical as well as negligence occurs at wrongly high rates and is considered as a main public health problem. The informant stated that experiencing that distressing event may feel threatened, anxious, and frightened as a result. Example of distressing event is that maybe that of family member, lover, a friend, teacher can affect the mental of the individual. And the informant also stated traumatized by sexual abuse often report feeling of shame. For this research study, firstly, the government should shift program that are giving better result and work. Uses a lot of money, but drug abuse are still worsening. Public policy must concentrate on addicts and abuser, not just patients, as well as social programs to eliminate many of the underlying causes of addiction. Secondly, preventing drug abuse cases by investing in the youth development itself and providing them with accurate information. Investing in the youth and keeping them engaged and active in life is most effective way to avoid from involved in substance addiction. Education should be a fact based, objective and taught not by police but by qualified educators and health practitioners. Lastly, they must focusing on law enforcement resources on the most dangerous and violent criminal. Federal government is priority is prosecuting drugs will be on large cases crossing regional and state. And also about this, help their abuse will be offered rehab services instead of prison. Drug dealers should be the lowest priority for law enforcement, while violent criminals should be the number one priority. Limitation in this study are firstly, the number of the respondents that want to be interviewed is insufficient. The researcher was only capable to organize interviews with 2 respondents. This problem occurs because of the pandemic COVID-19 that happens worldwide. The researcher cannot make any interview because of the government restriction. Secondly, the respondent schedule is busy and several of the respondents were not capable to contribute to the research because they're facing a busy schedule. But due to the limited number of the respondents for this study, the number of the information that is needed to be gathered by the researcher also limited. Thirdly, the researcher unable to use a face-to-face meeting with others. The researcher is unable to make this face-to-face either with the respondent and also the supervisor during this movement control order MCO. And all the organization and institution are compulsory to stop running. Suggestion for the limitation, firstly, is to maximize the number of respondents. In this study, the researcher only interviewed 2 respondents variable, which are family history, traumatic experience, and also mental health. Secondly, enlarge the component of the variables. The researcher used 3 independent variables in this analysis, which are family history, traumatic experience, and also mental health. This narrowed the spectrum so the other factor can be left out. Thirdly, the researcher can use online or virtual platforms. During pandemic COVID-19, this has forced the researcher to use an online platform to make a virtual meeting to collect data. During this moving control order conclusion, the factors of drug abuse must be observed and be curbed from to protect our youth from being infected and involved by drugs. In terms of the family support, it is important to overcome the drug addiction from getting more worse. In terms of the mental health, it is a big concern and for drug abuser to involve with it in the first place. Traumatic experience can become a turning point in a life that can influence or trigger illicit drug use. The data collected through in-depth interview session with the rehab facilities has been analyzed accordingly to the response to to the research objective